Hi everyone, welcome back. It was about a couple of months back we announced about certain documentary programs, transformation as well as workshop. Due to a lot of demands and requests, we're obliged to take different category and different strategic programs. So the transformation program with the documentary series will be prepared and be broadcast over TV channel, and we are going to inform you in a couple of weeks time. About the programs and the workshops, we are going to take in action in our clinic with a website, on our website, and you can follow. It has to be a certain series, maybe weekly basis, or we'll announce updated news. So welcome all. I'm Darakjian at the OPENMINDS Psychiatric Counseling and Neuroscience Center. Welcome. Today's program, it's going to be talked and based about digestive tract and about digestive process, which is divided into two phases. We are going to talk today about the first phase. What do we mean by digestive tract? Where it starts from, where it ends. So let's start. Digestive tract, the digestion starts from the mouth. Most of the people, they know that from the stomach, or I didn't digest well, and so on and so forth. No, it starts from the mouth. Then it goes to the esophagus, which is a tiny tube. It reaches to the stomach, and then it goes down to the small intestine and large intestine. The rest, it will be secretion and elimination part. So starting from the mouth and end up at the rectum. So this is a whole process of digestive tract. Today's program will be about based and the focus about the first phase, which starts from the mouth towards the intestine. So each organ has its own enzymes to keep the digest that food. Let's start from the mouth. Inside the mouth we have saliva, and saliva itself contains certain enzymes which call it amylase. It is digestion system to digest the carbs and the sugar that we eat. So here we go. The carbs digested in the mouth with the saliva with the help of the enzyme amylase. When there is no digestion in the mouth, we don't chew well, so there will be certain problems in our stomach. This is the first phase, the simple phase that the people will face. Afterwards, it goes on the esophagus, which is a small tube, direct to the stomach. What is the role of the stomach? The stomach contains certain enzymes as well, which digest mainly the proteins in order to break and make amino acids. So starting from the mouth where it goes and digests with the saliva, breaks down the carbs in order to turn to sugar, and sugar gives our body energy. While in the stomach, it's about the amino acid, which is the board sign and important blocks of our cells. Amino acids. Without amino acids, certain organs, certain tissues, certain muscles cannot function. Whatever the digestion will happen, if we don't chew well, even the proteins, there will be a digestive system problems inside the stomach itself. So stomach has its own process. Afterwards, we go back to a small intestine. Since small intestine started to create more and more and more and more and more in order to prepare for the large intestine and afterwards for the secretion. So any problem which the body contains inside the stomach, any problems inside the stomach, once it's in the stomach, it will be easier to concentrate and to help the patient. Sometimes when there is a food poison, the patient if it's still in the stomach, it is still fresh in the stomach, it will go and keep the person to split, to vomit. However, when it reaches to the small intestine, there is no passage to go back. The journey has to continue to small intestine and to large intestine. So between a small and large intestine, there is a degradation of the deep digestion and the system where the body started to be prepared before it reaches the liver and the kidney to keep concentration of the later on any system it goes, intestine, for example, for vitamins, for minerals, for liquid, for waste. It is whatever it happens in the small and large intestine, this is what it keeps us that the digestive tract, it's working properly or not. So mostly we concentrate on the colon, which is the large intestine. This is what we know: colon sensitivity, colon problems, any polyps, any indigestion problems, bloating, gases, all in the large intestine. However, most of us, we don't know that we have something called Sibo. Sibo, we are talking in a small intestine organism, which means the problem started and any difficulty of digestion started inside the small intestine, which is a Sibo, before it continues the journey to the large intestine. Now, what does it mean as a Sibo? Inside the small intestine, we have a certain degradation of like a cheese system. They are connected together. We call it alveoli or villi. They are connected together. Once we don't digest well, we don't chew well, the big particles, it comes to our stomach and then continues. The first step after the stomach is the small intestine. So inside a small intestine, when the particles are big and it's not digested and it's fermented, that cheesy system, the villi system, started to open up. And when it's opened up, it started to come inside the big particles to the bloodstream. Here we go. We start to have inflammation. So we have to be very, very careful to start our digestive system, our digestive process from the mouth itself. Chew well. Learn to chew well. If you cannot chew well, count between 15 to 25 before you swallow. No, you don't need any liquid to swallow. You don't need any beverages to swallow. You don't need anything. Just try to use your saliva with the gut creation, the amylase, the enzyme that is created inside your saliva. That is the big hint and the big help to start the first phase of digestive system. And inside of the small intestine, if its a process is correct, it's in a good shape, the process continues to the large intestine. The large intestine role to be prepared for the secretion. So today I'm going to end up here, and next program, hopefully by next week, we're going to talk about the digestive tract with its more illustrated health problems and how to solve those problems. Tune with us. Thank you.